and it's all yours, sir.
All right, welcome, ladies and gentlemen. Thank you, Brett. So my name is Hazmer Cassim. I'm part of Eisenhower Desert Orthopedic Center, and we're here to talk about pain and living life pain-free. Technical issue. There we go. So imagine waking up in the morning and you have some low back pain, maybe it's neck pain, headaches, and imagine how this would affect your day. Definitely change what you have had planned. You might have to go get some medicine. You might have to go to the doctors. But now imagine waking up this way for several weeks, maybe several months. And in some cases, this could be going on for years. And this is the life of somebody in chronic pain, where there is a problem that continues past the time period you would expect. Sometimes these issues are because of an injury, and the most common type of chronic pain is low back pain. It happens while you're playing sports, while you are traveling, moving, twisting, and these conditions usually get better with some time, some therapy, maybe some medications. But in some instances, when they don't get better, they're called chronic pain patients, and they have issues that linger on for a long period of time. 20% of all of the people in the United States have some type of chronic pain. 8 out of 10 people with chronic pain have depression, insomnia, and even 10% of the world's population is affected with this. So this certainly is a concern in society, concern in the world, and these people are suffering for extended periods of time. This is a map of the United States, and if you break up chronic pain, 116 million people, which is more than diabetes, heart disease, and cancer. 116 million people in the United States suffer from chronic pain. So it's definitely a considerable amount of people and a statistic that we need to take note of. Obviously, nobody wants to live in pain. Pain was a mystery for the longest time. People didn't know what it was. People didn't know what caused it. Pain is not only an unpleasant physical expression of symptoms, but is also an emotional expression that limits people from doing what they want to do. So how do we get away from this, and how do we live life pain-free? So today we're going to focus on the most common chronic pain condition that affects most people out there, and that's back pain. So we're going to talk about low back pain, different types of low back pain, the most common ones. But this does apply to mid, back, neck, and other areas of your body. Then we're going to go into the opioid crisis. And this was a big problem that affected many things in the future. And we'll see how that plays a role in the way we treat pain. Then we're going to focus on why treatments fail. Why do we still have so many problems when technology has evolved and people should be doing better? And finally, we talk about the future with new beginnings. So let's talk about types of back pain. So when people have back pain, that's a big umbrella term. It means many things. You could have a muscle pain, you could have pulled a muscle, or is it something that's going on for a long time? So the key to treating somebody with back pain is figuring out what is causing your pain. And that's where the diagnosis comes in. The diagnosis is critical to figure out a solution. Most people go many months, maybe even years without getting an appropriate diagnosis to get the right treatment. So the diagnosis when I see patients is typically based on history, meaning what happened, how did it happen, what were you doing when it happened? Then we do an exam to figure out where the pain is originating. sensory exam, movement exam. And finally, we might want to get pictures and tests. What I mean by that is imaging, such as X-rays, MRIs, tests such as EMGs, which is a nerve conduction test, or blood tests. All of these things are essential to figure out what's causing the pain. And without the what, you can't have a solution. So this is the first type of low back pain we're going to talk about. And as you can see from the former governor of California, Arnold Schwarzenegger, muscle pain is one of the most common causes of pain, not only in the lower back, but in multiple areas. How can you get muscle pain? Well, maybe it's the way you traveled, maybe the way you put your head while you were on a plane. Or maybe it's something you've been doing for a long time, like crossing your leg while you're on a laptop. And sitting in that way for an extended period of time causes different muscles to get weaker and other muscles to get tense. And of course, things that you do daily, like typing or, cutting things, repetitive use, all of these can cause muscle pains. So muscle pain is actually called myofascial pain, and it has an interesting history. This lady, Janet Travell, was the first female physician in the White House. She came up with this term, myofascial pain. She was the personal doctor to President John F. Kennedy. And John Kennedy, JFK, had a significant history of low back pain. He had 4 surgeries. One was a fusion, one was a discectomy, and 2 minor procedures for his back issue. And Janet Travell really revolutionized the way muscle pain was treated. This was in the 1940s. She has written many books which have been the focus of treatment for muscle pain. So she came up with the concept of a trigger point and referred pain. For instance, if you look at any muscle in the body, there is a specific point in that muscle. And in this picture, it's denoted as an X, that when you push on that, the pain will travel to the referred area. Meaning, if you push a specific point in somebody's neck, the pain can shoot all the way to the top of the head. You push a specific point in somebody's low back, the pain can shoot all the way down your legs. So myofascial pain can mimic and represent almost all major ailments, like heart attacks, like sciatica, or even headaches. And myofascial pain has become such a huge area in terms of treatment that Travell's work is very critical. She actually wrote a flip chart, multiple charts, identifying all the different trigger points she found throughout the body. As you can see here, trigger points in the neck cause headaches. Trigger point in the chest can cause pain shooting down your arms, gluteal pain, foot pain, even pain that represents carpal tunnel and shoulder pain. So these trigger points are very important for us to note because it is a huge component of pain, not only in the low back, but anywhere in the body. What are the treatments for this? Well, we want to strengthen the weak muscles. Stretching is very important. Strengthening is very important. And strengthening is done with physical therapy, chiropractic care, appropriate home exercise programs. And home exercise programs are the cornerstone for any successful treatment for muscle pain. We can use anesthetic sprays, acupressure, where we put pressure on those points, to dry needle, and even cortisone injections in these areas. And that can cause significant benefit. Now, again, Governor of California here, Arnold Schwarzenegger, stretching and strengthening and myofascial pain is very important because all the other back conditions we talk about have muscles involved. So when we go through the rest of this section and talk about common back issues, stretching and strengthening are still recommended, as that is the most important way to help any pain condition. Because if you have a problem in your body, a broken bone or anything like that, muscles are still affected. So for myofascial pain, we're going to another very common condition that everybody has to deal with, which is sciatica. As you can see with that red blinking nerve, sciatica is the compression of certain nerves in your back that shoots down your legs. Now, even though we're talking about back again, this type of a condition can occur in the neck, causing pain to shoot down your arms, or even in your middle back, causing pain to shoot down to your chest. Sciatica usually occurs when people do things and inappropriately with bad body mechanics. You see right here, jumping with bent posture, bending and lifting with the back, twisting and reaching. So usually when I tell my patients to avoid these activities, they give me a weird look and say, okay, I'll just sit on my sofa and not move. That's not what I mean. There's the right and wrong way of doing things. For instance, if you pick up a box, if you look at this picture here on the left, by extending your body, you're putting a lot of pressure on the vertebral column versus this picture, which is the correct way to lift something, where you're using your legs to lift. And this is a very, very common cause for sciatica, because when you twist and pick something up, like a grandchild or a puppy, you can cause a disc to herniate in your back that can cause sciatic symptoms. So let's look at these. Let's look at anatomy a little bit so that we understand how sciatica really takes place. So right here are different segments of the skeletal structure, okay? This is a vertebral bone in your low back or lumbar. This is thoracic and this is cervical. So these bones are stacked on one on top of another to form the vertebral column, okay? And if you look at this from a different angle, you see a big opening here. That is where the spinal cord goes through. In between each of these vertebral bones is a cushion called a disc. So right here, as we can see, each of these bones are stacked with the discs in the middle, and these little openings are for the nerves to come out. This entire structure protects the delicate spinal cord. The only thing in the body, for the most part, that doesn't regenerate from a musculoskeletal standpoint and your nerves is from a nervous standpoint, is your brain and spinal cord. Your musculoskeletal system, you break a bone, you pull a muscle, it can heal. The brain and the spinal cord, they do not heal. So very important to protect this. So if you look again here at our picture, that's the cervical or neck, 7 bones, thoracic, 12 bones, and lumbar, usually 5 to 6 bones. And that's the pelvic bone right there, which protects which protects the pelvic area. And if we look at the cushion in between, those yellow structures are the discs. And as you can see, there's a nerve root that comes out of each of these openings. So using anatomy, we're able to predict which nerve is pinched based on where people feel pain. Each of these nerves run down a very specific pattern in your body. That's where the exam is important. This is called a dermatome. So each nerve runs through a very specific part of your body. If you look at the picture in blue, that's your cervical or neck nerves. So if somebody comes in with pain in their neck that's running all the way to their thumb, that's usually the 6th nerve coming out of the neck called C6. If somebody has pain that's wrapping around their chest below the nipple, it's T5, as you can see in this picture on the yellow. If you go to the lower part of the body of this dermatome, somebody comes to me in clinic and says, I have pain that's running all the way down my leg. It crosses my knee and it goes to the inside of my ankle. That's the 4th lumbar or L4 nerve. So using these dermatomes as part of an exam, it really helps physicians and medical providers identify what nerve is causing this problem that's leading to sciatica. So again, when we treat sciatica, it's very important to realize that sciatica can be caused by many different things. So it's not an umbrella treatment. So if you have sciatica that's coming from stenosis, which means narrowing. So if you look at this picture, this is the disc, okay? And this is the yellow structure is the nerve coming out. Here, the disc has pushed into the canal and is pinching the nerve. And that pinching is narrowing the canal, causing pain to shoot down that nerve. Now here, this hernia, but the treatment, again, is different because the spinal stenosis caused by a herniated disc is treated very differently than we do for a degenerated disc. So what's the difference? So degenerative disc disease is a condition where there's arthritis throughout the spine. If you look at these little blue lines here, they all look like flat pancakes. They're supposed to look a lot thicker, like the picture down here. So when you have those flat pancakes, you could have arthritis pushing into the canal and pinching nerves. And then here's another reason for sciatica, which is piriformis syndrome, which means the nerve, after it leaves the spinal canal, is getting pinched by this muscle, and that causes sciatica. So the treatment for sciatica caused by spinal stenosis, which is a pinched nerve, is different than the treatment for sciatica caused by piriformis syndrome. This is where the exam, where the history become very important when you're appropriately treating patients. Also, a very powerful tool for us clinicians is imaging. We have CT scans, we have X-rays. X-rays are usually the first test you get, but it doesn't give us as much detail. Now, if you look at these MRIs, this is multiple views. The middle view is called a coronal segment, where we see a front, and the picture on the right is MRIs going from the sagittal, where we can see the spinal cord very clearly here. You see these discs in between showing us a lot of information. Using MRIs, we can scan through different segments of the spine and get a very good idea as to what's going on, okay? Also, there are some newer studies called SPECT-CT scans. SPECT-CT scans are very powerful because what they do is they take a CT scan and a nuclear image together, and they give us a color-coded picture of exactly what's causing problems. If you look at the SPECT-CT scan of the pelvis, you can see that on the hip joint right here, there's a little redness. And that redness would indicate increased uptake, which is a cause for pain right here. So that'll let us know that that patient has some increased pain due to the hip joint. So again, treating sciatica, it's very important to know what specifically is wrong and what is the cause for sciatica. So let's take some closer looks. Let's take a closer look at a few different causes for this and how we treat it. So this is a side view, meaning here's the spinal cord right in the middle. These white fluffy structures are discs, okay? Now, if you look at this exact same thing on the other side, you see the spinal cord here, but you see this big bulge right over there. That's a herniated disc, okay? So again, that's a herniated disc causing stenosis. We definitely want to treat the myofascial pain with stretching and strengthening. Medications are options, a lot of different medicines, all the way from anti-inflammatories, muscle relaxants, to pain medicines. But we also have medicines specifically designed for nerve pain, gabapentin, pregabalin. And we can even do guided treatments like epidurals and PRPs. And we'll talk a little bit more about that. Alternative treatments, acupuncture has shown to be beneficial in this. Again, there are a lot of alternative treatments which don't work, but there's some evidence-based alternative treatments which need to be focused on that can help. Surgeries, obviously an option if everything else fails, all the way from microdiscectomies to laminectomies if appropriate. But let's talk a little bit more about guided treatments. Guided treatments are types of tools used to put medicine in very specific areas. For instance, here, a shoulder injection has been done using an ultrasound. Ultrasound allows us to really visualize the joint and put medicine in that place. This is another type of injection done with an EMG machine. EMG machine gives us sounds that allow us to know which muscles are most affected. And obviously, the most common one, in addition to EMG and ultrasound, is fluoroscopy or X-ray machines. Here's a provider using, this is a patient here on the bottom, this is a physician, this is an X-ray machine. He's looking exactly at what he's doing as he puts the needle in somebody's back. So this is fluoroscopic guided treatment, and that's how we do a lot of our treatments. One of the most common treatments you probably heard for sciatica is an epidural injection. Epidural injections are a type of treatment where we put medicine, typically corticosteroids, in a space in the spine called the epidural space. So let's take a closer look at that. So this is an individual, he's facing this way, and this is the picture we've been seeing all this time. This is the spinal, this is a vertebral column here. This is the lumbar spine, this is the thoracic spine, cervical spine. Here's the nerves, and these blue lines are the discs, okay? So let's take a closer look at this. If we magnify the lumbar spine, we see that the yellow structures are the nerves coming out, okay? We usually have patients laying face down, and this is another closer look at the spinal cord. It's in a sac called the thecal sac, and the dura is the area around it protecting it. Above the dura is the epidural space. Now, when we're doing injections to get the medicine in that space, first we anesthetize the area with something like lidocaine to reduce discomfort. Then using X-ray machines, we guide a needle in through the fascia and the ligaments to that space. And then we're able to put some dye to visualize the space, make sure we're in the right position. And then we can put multitudes of medicines. We can put corticosteroids for epidural corticosteroid injections to reduce pain. We can put fentanyl and bupivacaine if we're trying to reduce acute discomfort or make people comfortable for pregnancy and delivery, all the way from platelet-rich plasma to a variety of different things using that technique. This is another X-ray picture of an epidural steroid injection that is done in a different angle called a transforaminal epidural steroid injection. And here's another cause of low back pain, which we can look at. And this is another cause for sciatica at times, which is a fracture. Obviously, right here, you can see a normal spine here, the one we showed before, and here is a fracture. That fracture can push into the canal, causing not only back pain, but also radiating leg pain, sciatica. Treatments, as you already know, stretch and strengthening important, bracing important to prevent further damage, medications like we discussed. And a special type of treatment for fracture is vertebral augmentation, where we can put some cement in the spine, and of course, surgery. And this is an individual with a compression fracture, and this is the cement that was placed in after. Now let's go to another cause for pain. Another very common cause for sciatica and even back pain is arthritis. If you look here on the left, we have our usual healthy spine. Here are the joints. And if you look right here, you see how this line is all collapsed while it has more space on this side. So here's a healthy joint, and here is an arthritic joint. Arthritic joint in the spine is similar to arthritis anywhere in the body, where there is no more cushion and it becomes bone on bone. It is hard to obviously do a replacement in the vertebral column in the spine because there's such small joints. So there are, again, a lot of treatments that we can use. Again, like I spoke earlier, stretching and strengthening is important. Definitely need to do that. Medications. But from a procedural standpoint, there's something called a radiofrequency ablation or rhizotomy. Here, needles are placed next to the nerves going to the joints, and we burn those nerves. Again, using needles, no surgery. And by dissolving these nerves, patients get 6 months to 2 years of relief. And that way we can release the back pain that people can have from facet syndrome. Obviously, if the facet joint is growing into the canal in what we call spondylosis, then the sciatic pain from that needs to be addressed, and that might be surgical if there's a bone spur growing in. Because those facet joints, when they keep growing and pushing into the canal, it almost becomes like a bone spur pushing in there. This is the radiofrequency ablation procedure under fluoroscopy, and this is what it looks like. Sorry about that. These are needles, and we connect them to wires, and we're burning all these nerves. And there's one more condition we'll talk about that can cause sciatica that's very common. It's called spondylolisthesis. On the left, we have our normal spine here with healthy discs. And on the right, if you look, there's the spinal cord, and this bone has actually moved in. If you look along this line, there's a deformity where this is pinching the canal. Spondylolisthesis, again, can be treated with our standard stretching and strengthening. Very important. Core strengthening, back stretching. And as you notice, myofascial pain is a critical component of any pain condition, and we focus on that treatment. Medications, like we discussed before, we can try epidurals, radiofrequency ablations, as we've discussed before, and finally, if needed, for this, surgery. As you can see, all these different conditions link into each other, and all these different conditions can cause sciatica. Now let's take a little time and move on to talk about the opioid crisis and why this is important. Well, originally, all these different back conditions we just spoke about were treated with opioids. In the 1950s and 1960s, it was considered the magical treatment for everything. Any type of pain, you got some pain pills. Pain pills were so popular and so successful, there was no limit. But people really began to realize there was a problem, and people began to see that there were issues with these opiates. So the story for the opioid medications, which is the base substance for all the different pills we have today, such as hydrocodone and Percocet, methadone, really comes from this flower. Opioid is a flowering plant, a specific type, found usually in the Middle East. Afghanistan has a lot of it. And as you can see, it's a beautiful colored plant. And these right here are the little flower buds. People realize that if you made some incisions to these flower buds, a clear milky substance, actually a milky substance, would come out, just like that. And if you left this milky substance overnight, it would solidify into a black kind of paste. This paste is opium. Opium revolutionized the world in terms of pain, addiction, and there were opium dens across the world. But in the early 1800s, Merck, a pharmaceutical company, identified a specific compound from opium and purified it and named it after the Greek god Morpheus, the god of dreams, and began to use it just for pain. And then morphine was used in the First World War, Second World War, and it began the revolution of pain management. And pretty soon, 1960s, 70s, we had fentanyl, Percocet, Vicodin, Demerol, methadone, and many different ways of delivering it, IV, orally, through the skin. And this seemed to be the miracle cure. Everybody loved it. But pretty soon we had problems. And in the not early, but 2019, people realized that we had a problem or a crisis, an epidemic. And in 2019, 2017, people were dying of opiate overdose. People were dying because they couldn't breathe. And these are all side effects of the medicines. And there were multiple reasons for this. We had, over 60,000 deaths between 2016 and 2017, 17% deaths. It became the leading cause of death, people under the age of 55. And over 23,000 deaths also from synthetic opioids, 14,647 deaths from prescribed opiates. So actually, physicians were giving people medicines that were killing them. So this crisis came about due to many different things, and we have a lot of movies and TV shows made about it today. Painkillers is one of them, and that talks about the ways in which the pharmaceutical company had corruption and infiltrated the medical field, and it was a corrupt plan to get people hooked on medicines volitionally. This Pain Hustlers is a new show that came out. Movie talks about a cancer drug that physicians inappropriately prescribed to non-cancer patients, causing deaths and addiction. Because these medicines cause addiction, cause dependence, cause tolerance, and easy to overdose. And finally, Dopesick. That's another show going on. So essentially, the opioid crisis was caused by a combination of the intrinsic properties of these pain medicines, which is addiction, dependence, tolerance, as well as corruption in the medical community, the pharmaceutical company, and the lack of regulation. Now that we are in a better place, where there's a lot more techniques to monitor patients with what they're taking, a lot more education in who should get these medicines and who should not get these medicines, the dosage of prescribing opiates is significantly reduced. But now, I call this the aftermath, there's the fear of pain medication. I got a call from an ER physician a while ago. He had a young 18-year-old boy who had a fracture of the femur. Femur is the bone, the upper part of your thigh. It's a big bone. And this kid had a fracture, and he was going home, and the ER doctor called me to see if he should send him home with an anti-inflammatory like ibuprofen, because he felt uncomfortable giving this patient any Vicodin or hydrocodone. And this I see a lot, where people are now afraid of doing any medications. A fracture of the femur is very painful. They probably need some Vicodin, especially in the acute stages where they're healing it. The DEA suspended many physician licenses. DEA is a drug enforcement agency that gives physicians the ability to prescribe medicines. They monitored many physicians for overusing opiates, and even in the Coachella Valley, back in 2019, 3 or 4 primary care physicians and even a pain doctor lost his ability to prescribe pain medicines for inappropriate use. And across the country, physicians were arrested for increased death. There was a case in California. A female physician was arrested for multiple deaths related to opiate prescribing. And again, most of these were not volitional causes or prescribing attitudes, but it was part of the opiate epidemic. And today we have pharmacies that are afraid to dispense these medicines. I could have a patient who's been on medicines for cancer pain, significantly high doses of opiates. And in a cancer population, we do give more pain medicines because they are suffering and they are not at the risk of long-term dependence. Unfortunately, because the nature of the disease is the life expectancy is reduced. But pharmacies have refused to dispense these medicines without even knowing what's going on in the patient. So these are all the aftermath concerns since the opioid crisis. All right, so we looked at the different types of common back pain, opioid crisis. So let's talk about why treatments fail. We know a lot more about why people have pain. We know a lot more about what causes these different symptoms. We have appropriate treatments, but why do we have so many people still in pain? One of the big problems is not realizing the difference between acute and chronic pain. Acute and chronic pain, even though they sound like two simple words, where something is not long-lasting, acute, and something is long-lasting, chronic. These are really two different diseases. Let's take a moment and talk about how that happens. Well, pain is very unique. Pain is a condition that is there, a symptom of multiple diseases, and it has its own receptors. They're called nociceptors. These nociceptors respond to multiple stimuli of discomfort and pain, and what they do is they take a signal all the way from your body. Imagine you stubbed your toe. The pain signal travels through your body from your toe all the way through your spinal cord and goes through your brain where it's processed. And that's where you feel discomfort or pain. And now this is a very negative symptom. It's not pleasant. So any type of a medical issue, such as kidney stones, such as chest pain, such as back pain, such as sciatica, you have this type of signal transmission. This is one of my favorite pictures from 1664, showing signal transmission of pain, like I explained in the last slide. But this was obviously many, many years ago, hundreds of years ago. It was done by a French philosopher, René Descartes. He was a philosopher, a scientist, and he actually identified what we call today the spinothalamic tract. What he said was, if you have a fire right here, A, and you put your foot in it, it pulls a rope, which is B, that goes all the way to your brain and pulls a bell in your brain. And that's, in a very rudimentary scale, the spinothalamic tract. That's what happens. So he was revolutionary in identifying this. Before René Descartes, people thought that pain was controlled by your heart, pain was controlled by emotions. Nobody really had a concept of what pain really was. And so this was a revolutionary picture in expressing how pain is transmitted to the brain. But today we know a lot more. We know that there's something called peripheral sensitization. Meaning, if you have pain that lasts more than 3 months, there are changes that takes place in the area that's affected. For instance, instead of putting your foot in fire or dropping a hot pan on your toe, if you have an arthritic wound or a chronic burn, lots of interleukins, a lot of chemicals are released, causing a revving up of the peripheral area, meaning this place becomes more sensitive to pain. Also, in the spinal cord, something called central sensitization. It's a very complicated process where different neurotransmitters open up different receptors. So if it's acute pain, meaning you touch a hot pot, there's no peripheral sensitization, the signal travels to the spinal cord, and glutamate goes into a AMPA receptor. But if you have chronic pain, meaning the pain is there for over 3 months, you have peripheral sensitization that releases different neurochemicals to the spinal cord that opens up this NMDA receptor. So as you can see, from a cellular standpoint, after 3 months, acute and chronic pain are different. But there's more. This also affects the brain. It's called cortical reorganization, meaning the way people think, the way people feel, everything changes. So pretty soon, after 3 months, the perception of pain changes. It adds depression, mood changes, and we have a much different and much more challenging condition to treat. Some of these mechanisms were used and today explain how somebody has phantom limb pain. For instance, if you can look at this picture, I have patients come to me in the office and sit on a table and say their foot hurts. I look down, they don't have a foot. So it's the central and peripheral sensitization with cortical reorganization that explains this phenomenon. Acute and chronic pain is a very basic concept that has not been appropriately used, which led to the opioid crisis, and now today leads to undertreatment of patients. If somebody has pain that's longer than 3 to 6 months, That's chronic pain. Opiates are not the best for that. But if it's acute pain, like an appendix that's ruptured or a broken bone, people do pretty well with opiates, and they probably need that. Back pain, carpal tunnel, abdominal pain, migraines, all these different conditions can be treated appropriately if you identify if it's acute or chronic issues. Chronic pain, in order to be successfully treated, needs a comprehensive program, not just fixing the problem, which is important. And that goes back to the idea of a good, clear diagnosis. So when somebody has chronic pain or even acute pain, history, physical exam, imaging is essential to identify what's going on. Once you figure out what's going on, treat the problem. And if it's acute pain, people will do well, and that's all you need to do. But if it's chronic pain, in addition to treating the problem, you need to make sure that their emotional aspect is addressed, because there are changes in that area. Also, right medicines for the chronic pain. We want to use proper myofascial techniques as well. And all of these different types of treatments form a comprehensive plan for individuals with both acute and chronic pain. There are also some treatments specifically designed for people in chronic pain. This is called neurostimulation. Here is an individual. On this picture, you see him using a syringe. That's to figure out if he is in the epidural space. This is an X-ray of the low back. He is T12, or thoracic spine right there. This is an individual putting a needle between T12L1. Once you put that needle in there and you have this loss of resistance, you can actually put some wires. These are wires. It's called a neuromodulation spinal cord stimulator with a little electrodes. You see all these little black dots, like a caterpillar. This is my needle that lets me know that I'm at T11. These electrodes essentially block pain from going to the spinal cord. So once you have a chronic pain condition and you've tried to fix the problem and it's not getting any better, we need to fix the ability of the body to send that signal to the brain. And that's where neuromodulation comes in, and it can help you. Neuromodulation is exploding in terms of different types of treatments, so many different companies out there, and it continues to be a huge, huge type of treatment for chronic pain syndrome. So we've looked at different things, and we're coming towards the end of the lecture here. And we're going to look at the future. Future of hope. So obviously, over the years, we've learned a lot. From the days of René Descartes in 1664 to 2023, understanding of cellular anatomy, biochemistry, and the whole options of treatment has exploded. The Human Genome Project was completed, where the blueprint of human life was identified, and we continue to make strides with this to help those in pain. There are a group of people who have no sensitization to any pain. These individuals lack nociceptor expression, and those are the pain signals. Right now, we're studying different types of techniques where people can have gene expression change so that they have limited expression of pain, and medications to shut down certain receptors in the body. And hopefully in the future, we'll have a working prototype for this. Technological advances have allowed us to do many types of treatments with minimally invasive procedures. We have improved technology to do injections, implants. There are fusion techniques that are minimally invasive. There are SI fuse. There are surgical techniques that are minimally invasive with better outcomes. So not only has our knowledge about the human body improved, but our treatment options have gotten better. And this continues to grow in the future, revolutionizing ability to treat people with pain. Also, a whole new brand of treatment, THC and CBD, is exploding in the market. Pretty soon, medicines are going to come out to treat not only pain using THC and CBD, but sleep, hypertension, um, thyroid issues. And this is going to be a new wave of therapy with limited side effects. Stem cell is getting more and more popular, and stem cell therapy is very controversial. Stem cell is a cell that can change into any type of blood, any type of product, like cardiac cells. You can have red blood cells, neurons. So if you are able to properly harvest these stem cells and put them in specific areas of your body, they can rebuild that part of your body. Currently, we don't have the exact technology to do that complete rebuild. Even though stem cells are being used right now, we still have to work on the proper harvesting techniques, proper delivery techniques, and see the true potential of stem cell therapy, which I think will happen in the next 10 to 15 years. All right, ladies and gentlemen. So we've spoken about different options to live life pain-free. We spoke about very common types of back pain. We spoke about good diagnosis to identify what's causing the pain with the focus on myofascial pain. We spoke about how this magical opioid medicine, which was used for decades, led to a crisis, which has now left us with some repercussions. We also looked at why treatments fail, and finally focused on the future, a future of hope for us all. Thank you.
All right, fantastic. Excuse me. Can you hear me? Yeah, fantastic, Dr. Cassim.
Thank you.
Let us open it up for Q&A. If anyone has a question, we don't have anything currently in the chat, but if you want to ask a question of the doctor, please just unmute yourself and ask your question. I know one that always comes to my mind is when you talk with a pain specialist or a primary care provider and they say, take an Advil or take an ibuprofen or some basic things like that, but then they do a combination. Can you talk about what that looks like when you take like a Tylenol with an ibuprofen?
Sure. So the idea is to not overdose with one of these medicines. Ibuprofen and Tylenol are very good and effective, but there's a certain dosage that's maximum for the day. What we like to do is use an anti-inflammatory category of medicine, which is the ibuprofen or the Advil. And you can use that 3 times a day, but in between those doses, you can use Tylenol. And that way you're not overdosing on the Tylenol and you're not overdosing on the Advil, and you still get the benefit of anti-pyretic or reducing fevers, as well as the pain reduction value. And that's a good way to control your pain with added stretching and strengthening.
Great, thank you. We did have a question that came up on how to get in touch with Dr. Cassim. I know, Doctor, do you want me to give the general phone number? Is that the best?
That's great.
Yeah, so the general phone number, and I'll put it in the chat as well, is 760-568-2684. And that is Eisenhower Desert Orthopedic Center here in Rancho Mirage. We do have another location in Arduous, but the Rancho Mirage is ideal to get a hold of Dr. Cassim. And I will put that in the chat right now as well. Give me 1 second. And if you are currently a patient of Dr. Cassim, then you, of course, can go to my chart and send him a message. Go that direction, or you can call the office and they'll be able to answer the questions you may have. Other questions or things in the chat that you would like to chat about, or the doctor?
I put a question in the chat.
Yeah, how long does it take to get an appointment generally? Is that the question?
No, above that.
Oh, hold on a sec here. We had how to get in touch with Dr. Cassim. I have in there, which I get the phone number. I can redo that. How long does it take to get an appointment?
I have one that says procedure called an ablation.
Oh, there you go. I don't see it in my chat, which is odd. So my apologies, but go ahead, Dr. Cassim.
Oh, somebody asked me a question here. It says, I had a procedure called an ablation. It lasted about 18 months. Can I have another or something else as the pain is returning? So good question. Thank you. An ablation is that procedure we spoke about where we burn the nerves in your back for arthritis pain. And usually it lasts, 6 months to 2 years. If the pain returns within that time, yes, you should definitely get another one so that you can control the pain. And again, the goal is after the ablation to really strengthen your muscles. Again, myofascial pain, core strengthening, and back stretching. If it's over 2 years, we might have to do those test blocks again to make sure we're going to the right spot. But yes, you can repeat the ablation.
Thank you.
All right. Other is PRP effective in treating sciatic pain?
Good question. So PRP is platelet-rich plasma. What happens is you go to the office, we pull your blood, spin your blood, and then the blood kind of breaks down to different components. One of the components of your blood is platelets. Platelets are very useful for healing, meaning if I cut my hand or arm, platelets signal your body and they send healing molecules that help fix it. So we take these platelets and inject them in different areas and trick essentially the body to send healing molecules to help fix it. So when we're talking about sciatica, it depends on what's causing sciatica. So if it's a muscle problem, PRP can help. Stenosis, maybe, because stenosis is a mechanical compression. It's like something pushing on that nerve. The disc is pushing on the nerve. So we need to do something to directly fix that. And corticosteroids with the injection can reduce the inflammation and help that disc heal. But if the disc is too big and pushing in, you might even need some minimal, like a discectomy, minimally invasive surgical procedure, something to reduce that mechanical pushing. So the answer is a yes and a no, depending on what's causing the sciatica.
Perfect. Follow-up questions or other questions from anyone, please feel free.
What about knee pain and hip pain?
So knee pain and hip pain, again, the principles I spoke about are applicable to any pain, even the knee and hip. So the goal is, one, figure out what's causing it, diagnosis. So we need to do, history, physical, imaging, labs, diagnosis, then identify if it's acute or chronic, and then work on a plan. Depends on what's causing it, how long you've had it, and then we can come up with a good option to help.
Fantastic. Now, do you have to see a primary care physician to get a referral to see you, or how does that work?
I think it all depends on the insurances. Some insurances require a primary care referral. And talk to your primary care doctor, because we like to work with them anyways. They're kind of the quarterback of the team, and we will help them with your care.
Fantastic. Additional questions from anyone? Feel free to keep asking. Got a few more minutes.
We've tried to get a primary care doctor. We're snowbirds, so we're down here, in the winter. And at Eisenhower, we haven't been able to find one. Everybody's busy; they won't take us.
They won't take new patients.
Wow.
It is a well, that's throughout the valley at the moment. And then the good news in the primary care, if I just may ask, are you in the Palm Springs, or what area of the valley are you in?
Cathedral City.
Perfect. Okay, so two things that are coming up. Number one, we do have two primary care physicians, one starting just January 2nd, another one that I believe is starting before end of year, both at the Rimrock location in Palm Springs. general primary care for the most part, and or HIV, depending. Cathedral City is our residency clinic. And I know while they have been swamped and holding off, they do take, especially since you're snowbirds, I always recommend to individuals that you have a primary quarterback, kind of a primary physician here. They can assess your records, they can do your prescriptions, all those kind of things. The residency clinic in Cathedral City, which is in the right next to Target, right there off Palm Canyon, that's a great location to go in and talk with them. You may have a couple of week or 3-week wait, but you'll be able to get a resident physician, and you get a team of 3 individuals along with a proctor who is always looking at your appointments and looking at your, meeting with you at every single appointment. They're longer appointment times and faster access, and be able to get the things you need. So those are the quick kind of things that are happening right now. And that may, I think, again, guide you on what you might need. Hope that helps.
Facility called next to Target.
Yes, so it's the Eisenhower Clinic, and you can just walk in as well, and they'll tell you when the next appointment is, what you're looking for. It's an internal medicine residency clinic, and so you're assigned 3 different residents in a team, a first, second, and third year. And then, as I said, you always have a supervisor physician who's a specialist who will always meet with you to look over your chart and everything that you've done during your appointment. So yeah, they're right there between the car wash and Starbucks and Target.
Okay, got it.
Yeah, that's by far your, I think, easiest path right now. We are in the Valley, all hospitals and medical are finding a primary care shortage at the moment, or delay. Any other question for the doctor? All right. Well, we are at time. So Dr. Cassim, thank you again.
Thank you for having
I
me.
learned more things. And of course, I now have more questions for you, as always,
Thank you.
when I get done.
See you.
All right. Thank you, everyone. Have a great night. And this, as I said, will be has been recorded. It will be edited and will be online within the next 2 weeks on the EisenhowerHealth.org website, as well as on our YouTube channel. Have a good evening.
Thank you.